everyone, welcome to my talk today, Developing Your Leadership Skills in Nursing, which is part of a Leadership in Nursing series. I've got lots of other videos on my YouTube channel, Support and Career Development for Nurses, such as decision making in nursing, coordinating care, delegating nursing care and teamwork in nursing. All the videos are free on my YouTube channel, and just hit subscribe if you want the weekly notifications. This session today is aimed at students, newly registered nurses and early career nurses developing your leadership skills. And you might be on a leadership module at university or doing an assignment, and I will be going over an overview of some key leadership models and the different styles of leadership, talk about some literature linked to impact of leadership and how to develop your leadership skills in the future. I've worked as a nursing sister, senior nurse in the NHS for many years, and I've worked with hundreds of leaders and observed what works, what's effective, and also reflected on my own sort of leadership style and leadership skills as well. So I hope you find the session helpful. Oops. So why is nursing leadership so important? There is evidence that nursing leadership may impact on patient experiences and outcomes and nurse satisfaction and retention. And we're seeing a little bit more research in this area due to staffing issues across the UK and the need to retain staff. There is evidence, and I've reviewed several papers, and I chose sort of 3 literature reviews to share some of their findings. Quinuku et al. 2021 focused on nursing leadership styles and their impact on intensive care unit quality measures, and this was an integrative review. They found that active nurse leaders who share a common vision and advocate for their staff are perceived as more effective than those who exhibit absentee characteristics. Therefore, nurses like to see their leaders on the ground advocating for them. And there's that relational need for a relationship to be developed. Productivity and nursing morale was influenced by nursing leadership. Outcome measures such as intention to stay, job satisfaction had a positive relational effect with nursing leadership styles. And the authors call for more research in this area on how leadership styles affect leavers rates and retention, for example. Cummings et al. In 2018, they focused on leadership styles and outcome patterns for the nursing workforce and work environment, and this was a systematic review. And their findings, they had found that patterns between relational and task-focused leadership styles and their outcomes for nurses and work environments, that's the basically aims of what they were looking for. And they found 52 studies that reported that relational leadership styles were associated with higher job satisfaction in comparison to task-focused leadership styles. And I'm going to talk about those different leadership styles, so this will hopefully put some of that into context. And task-focused leadership styles were associated with lower job satisfaction. Collaborative, compassionate leadership is a more relational-based style versus that checklist, target-driven approach, which was found to be associated with a lower job satisfaction. McKay et al., similar to Cummings et al., McKay et al. Focused on nursing leadership style, nurse satisfaction and patient satisfaction as a systematic review. And again, their findings suggested that relational leadership traits contributed to greater nursing satisfaction, whereas task-based styles decreased nurse satisfaction. So this is really interesting stuff here, and it's interesting to reflect on those papers with your modulees, How does it link to healthcare currently, where we work environments where staffing may be down, for example, and autocratic task-based leadership may be more prevalent? It's more likely to be used when there's lack of time, for example. And we have to remember that leadership styles and approaches are influenced by context, and a whole picture has to be taken into account as well, which I'll talk about. So we have some classic leadership approaches and styles, many of which you've probably covered in university, but I'm going to give an overview with some practical application, keeping it very simple. Looking at management versus leadership. Management is about keeping things running smoothly, organising, directing staff and systems. And some examples might be budgeting, doing appraisals, managing personal development reviews. So you've got already established systems and goals. Leadership is about creating, changing something, working towards a new goal, inspiring, having a vision, and creating perhaps new student packs in an area, leading a project. And you could do that as an early career nurse, where you are creating some resources for new starters, for example, or for students in an area. So when we look at leadership theory, we move from trait theory, where leaders were born and they had these innate characteristics and traits, to nowadays where leadership is more viewed as a dynamic process, it's multifaceted, and leadership skills can be developed through leadership programs, through experiential learning, I would say would have the biggest impact. And we have a massive rise in leadership programs. When I started my career, we had none of that. We were to organise, manage and taught skills, whereas nowadays nurses are managing £1 million budgets. They're having to develop leadership skills. If you're a senior nurse, you're expected to do leadership programs and to develop those skills. So we've moved from leadership models that were more centralised to where we had one person leading, to a more collaborative, relational approach to leadership. As was mentioned in those previous papers, they talked about relations and the relationships being very important to having an impact on keeping staff and retaining staff. I find it really interesting that students are being asked to develop leadership skills early on. We've got the NMC code and those changes. And I do think the terms management and leadership are blurred very often. And, you know, you have people saying, oh, you're going to be leading the care, and if you educate your patients about their medications, you're leading. To me, that's medicine management. All patients should have education about their medications. Whereas if you're helping a family with looking at new strategies for care in discharge, it might be more linking and adapting something creatively, but they are interrelated, and you can't have good leadership without having those managerial and organisational skills, being able to delegate, prioritise and promote positive team working. So your focus as an early career nurse may need to be on those key transferable skills over time with experience and further education. So don't put too much pressure on yourself thinking you've got to be this amazing leader when you register. And that's not to say students and early career nurses can't lead projects and lead care. You can be very knowledgeable about a particular area and have a passion for an area and want to sort of implement change and lead change as an early career nurse, and I'll give some examples later. So looking at some classic leadership styles, we have autocratic, democratic, laissez-faire, which I'm sure you've all heard about. So with autocratic and sometimes this is called authoritarian leadership, leaders make decisions without collaboration. It's effective in urgent situations where decisions have to be made quickly. So a cardiac arrest, you don't have time to debate. You may have a patient that's self-harmed, that's bleeding profusely, or somebody that's trying to get out of bed and you don't want them to fall, and you are trying to solve a problem quickly. So during COVID, we saw lots of this type of decision making. Staff were redeployed quickly, we moved areas quickly. There may have been a mix of leadership styles there where there was a bit of discussion before, but decisions had to be made on which wards moved, for example. If you were in a large trust, you saw a lot of that. There wasn't as much discussion. It relies on leaders making the correct decision and people having trust in those leaders to make those decisions. It's very effective during a crisis, or if staffing levels were poor, for example. Democratic leadership, it's participative is the other name for it sometimes, and there's open communication between leaders and staff. Everyone's involved in the decision-making process. We're looking at redesigning our staff room, for example, or looking at education long term, and this type of leadership style is effective for sort of more longer term decisions that might impact the team, and whereas in contrast to a quick decision, so it wouldn't be as effective with quick decision making. Laissez-faire, which is French for leave alone, sometimes it's called hands-off decision leadership style, and leaders give no direction. The staff are left to make their own decision. And as I mentioned, the paper early, Kawangnuku et al. 2021, they mentioned staff perceived actors leaders as effective, not absent leaders. So if you've got an experienced team used to working together, this style of leadership may work, but you need to usually have experienced staff. Junior staff, early career nurses will want to see their leaders, as the research showed in those literature reviews I mentioned earlier. And also leaders can be seen to be uncaring if you don't see them at work as well. And it can also allow, I would say, in my opinion, it would also allow cliques to be formed and bullying potentially. If you allow staff just to get on with it and you're not monitoring and watching what's happening with your team and how those team dynamics are working, laissez-faire is not good in that sort of situation as well. Looking at transactional and transformational, these are relatively new styles of leadership. Transactional is more of a top-down approach driven by organisations using incentives, awards and punishments, and it assumes staff need structures to complete tasks. It's used across employers. For example, transactional style of leadership focuses on established routines where each team member's got a specific responsibility. So lots of NHS trusts run staff recognition awards, for example, to reward performance, whereas you've got the human resources procedures to adhere to if you don't meet requirements of your role. Transformational leadership is sometimes called visionary leadership, where leaders work together in teams to create and transform, looking to the future. And it's usually used by employers that are looking to make changes and looking at a bigger picture across teams. Many NHS teams, I would say at the moment, and trusts are looking at wellbeing support, for example, and looking at their vision for recruitment and retaining staff leads. You've also got other newer models that look at collective inclusive leadership, patient-centred leadership, shared collaborative and compassionate leadership, and some good papers to look at and work. I think I've put the reference for Michael West. He's a professor of work and organisation psychology, but he's written a lot about collaborative and compassionate leadership, so do check out his work. And also authentic leadership will be linked to a lot of these newer models where leadership needs to be authentic. You need to trust your leaders. So that's a quick overview of those. So what is the best leadership approach? So evidence suggests that nurse leaders should adapt their leadership behaviours, and I absolutely agree with this. over my 35 years as a nurse and a nurse tutor, I've used different leadership approaches depending on the context. And you've got all these extraneous variables as well that can occur. So it depends on the people you're working with, their experience, the decisions that are being made, the problem, the issue. Does it need solving quite quickly? Do I have time pressures on me? Or do I want to look at more motivating and inspiring a more long-term vision, for example? And so Maxwell 2017 wrote a paper on good leadership in nursing, what's the most effective approach, looking at leadership approaches. And it's a really nice paper because it's really practical. It outlines different leadership theories. So there's a lot of, it's written in the Nursing Times, and I know that some universities don't like you referencing Nursing Times papers. There's some great references in that paper as well. But Maxwell outlines different leadership theories and how they can apply, and the 4 skills of nurse leaders. I like this quote: nurse leadership is in truth a pragmatic blend of theory and evidence adapted to local circumstances, flexible enough to respond to the reactions of the team and agile enough to deal with the unexpected, because it's a real practical approach that would link to nursing leadership. Maxwell also talks about how nurses should adapt their leadership style to the task in hand, which might require a transactional approach, to the needs of the team requiring a transformational approach, and I've explained those 2 approaches earlier, and to the key requirement of building and maintaining productive relationships, which again, I would agree is so important with leadership, developing those authentic, genuine relations where staff will trust a leader. Maxwell in 2017 also presents these 4 key skills of nurse leaders, and I really like these because these are practical and work, I think, in my own experience. So the first one, monitoring and calibrating the team's workload. And so in my opinion, nurses, I relate to this, leaders need to really know their team and their team members' individual strengths and skill set. You're that bridge between the workforce, the organisational service requirements and your team. So you need to know your team, know what's happening, and have that global overview to be able to calibrate the team and monitor that workload. And it's advocating for your team as well, and sort of knowing the boundaries between the reality of what you have to deliver and what is acceptable, the workload to put on your staff, for example. So number 2, creating a work environment in which all staff feel they can contribute the maximum in a fulfilling way for them. And reflecting on this, I think it's you're as a nurse lead, it's becoming knowledgeable, enabling nurses to become knowledgeable, competent, feeling confident, and creating that work environment to enable them to do that. So having those supporting structures, clinical supervision, buddies, preceptorship, saying hello, and it's not just walking past saying hello, it's stopping, having a meaningful conversation. You actually mean it. You've got active listening, showing that you care about your staff, and it's that authentic leadership. So that's a really interesting one. The third one, creating relationships that build resilience, and it's, to me, looking at where staff can approach leaders, feeling that they can contribute. So having regular communications, meetings, having structures in place. So if people are on nights, for example, how are they going to keep that relationship going, that, you know, there's other methods that you can use and strategies for ensuring that you involve everybody's views, for example, and scoping staff views, having service improvement projects where all levels of staff are involved. You know, when I talk to staff in an area and the healthcare assistants are singing a leader's praises, I know that that leader, that nurse leader, has built and created those relationships at all levels of staff. and you know, you can see it, and you walk on a ward and the staff will talk about their leader positively. You might want to hold monthly group meetings with all levels of staff. And there's lots and lots of different strategies, and it depends where you work, obviously, as well, and the different settings that we have and fields. Number 4, ensuring that the team delivers safe care, good experience for patient and staff, and best use of available resources. And we always have to remember the reality is that we're working within financial constraints and budgets. But looking at what opportunities there are out there and being creative. We've got alternative funding for education, for fellowships, studentships, and I did a talk recently on how to access funding and what sort of funding streams there are for education if you cannot access CPD, continuing professional development funding, that there are alternatives, looking at charitable funds and being mindful of not wasting funds or resources. And resources goes across not just equipment, it's staffing resource as well, and looking at effective working. Because if you don't stay in budget, the reality is you may lose budgets, and there may be implications on future resources. Now, looking at how you develop your leadership skills as a student or a newly registered nurse. So just some key tips here. So developing your leadership skills, first of all, I would say you need to increase your self-awareness and knowledge through peer feedback and self-reflection, and keep that going when you've finished your degrees as registered nurses and early career nurses, reflecting on experiences and having that experiential learning where you're in practice and you are asking for feedback proactively on your practice. Accessing peer support, clinical supervision, coaches and career advisors, and group support. Thirdly, academic and professional courses. It's not just leadership courses, it's courses to develop your knowledge and your skills in your specialism as well, to give you confidence. And joining and supporting leadership projects and learning from others was the key way that I learned my leadership skills. So reflecting on practice, regularly reflecting with peers. You can reflect if you're really busy at one, know the reality at work. It might be that you join national forums, lots of supportive groups in Facebook, on social media, but increasing your self-awareness and knowledge through professional feedback. There's a new book out by Heather Henry, Be a Leader in Nursing, and there's lots of examples of where students and early career nurses are reflecting on their practice and have focused on that they've given some example sort of projects and leadership and change that these early career nurses and students have demonstrated. Natalie Elliott, who's a registered nurse and an Elsevier editor, discusses leadership and the importance of reflecting on positive achievements in their author's podcast. That's a really good podcast to listen to. And she's also, there's also other podcasts linked to leadership as well. And it's just helpful to listen and to share resources and to look across the spectrum of what's out there, to educate yourself. And it's the real world application of leadership for students is a lot of what they're talking about. And I know in that talk they talk about procrastination, which is really helpful as well for many people, including me. Developing key transferable skills. So we've got experiential learning is the key way to develop those leadership skills. But initially, as I mentioned, you've got this management and leadership is often blurred. The boundaries are blurred. And if you're going to look at leading projects or developing your leadership skills, you need some organising. You need to be able to manage your caseloads and workloads and look at those key skills: decision making, prioritising, delegating, coordinating care and supporting others, and team building. Also knowing about role boundaries. So when you first register, you need to know what healthcare assistants do in your area, what competencies they've got signed off, what do nursing associates do and assistant practitioners, because you are going to be delegating to these support roles. No local and national policy, legislation, standards and evidence base underpinning your care. So there's all that grounding that you need, which will inform your leadership and help you develop your confidence. I have some other videos out on decision making in nursing. That's coming out next week. I've got videos already on my site, YouTube channel, on delegating nursing care, teamwork in nursing, and also a talk on the differences between a nursing associate. Also, I talk about assistant practitioner and registered nurse for those of you looking at delegating when you're first starting out. So they might be helpful for you. Looking at professional education and academic courses. Now, there is a student leadership programme for student nurses that some of you might want to look at, and you can apply to do projects, and there are fellowships, studentships, post-registration specialist courses are very helpful for you because you're increasing your knowledge in whatever area you're passionate about. You've got Masters in Healthcare Leadership, the NHS Leadership Academy, and the Florence Nightingale Foundation has got different courses on the and scholarships, that you can apply for. On the NHS Leadership Academy courses, there is Edward Jenner, a free e-learning programme aimed at new leaders. The Mary Seacole programme, which is people looking to move into their first leadership role. There's the Rosalind Franklin programme, which is more mid-level leadership, people leading departments. The Elizabeth Garrett Anderson, which is mid-level leaders, and Nye Bevin courses for senior leaders. So you've got leadership programmes, but you've also got academic master's programmes that are for all healthcare professionals. So you might do a master's in healthcare leadership, for example, with a university. So all of this will help you with your developing your leadership skills along with your experiential and your learning in practice. When you're looking to develop your leadership skills, you also need to develop your skills presenting, educating and developing others is really helpful to develop that confidence by supporting others. So acting as a practice supervisor, sharing ideas and resources and experiences, for example, orientating, inducting new starters and teaching others, developing resources, teaching packs, leading staff patient support groups or developing documentation, and being part of groups, collaborating together where you might chair a meeting for the first time. These are all skills that are going to help you develop and inform your leadership style in the future. Looking at influencing practice, promoting evidence-based practice is helpful again to inform your leadership style, and running a journal club might be something you can do early in your career, or collaborate with a lead. You can just watch and join and observe a leadership project, a service improvement or a quality improvement project. Looking at publishing, you can have an influence in nursing through publishing and using your voice, contributing to policy development at local or national level, and linking to professional forums or shared governance groups. We have the RCN Leadership and Management Professional Forum, for example, and you might have local groups as well. And attending conferences that align to your role and sharing what you've learnt with other people. I've got a video on 5 ways to influence nursing practice, talking about some of those in a bit more detail. Leading projects, so supporting line managers, local leadership teams, and observing and shadowing leaders, linking to local and national quality improvement forums and networks, and as I mentioned earlier, collaborating with or leading a quality improvement or service improvement project. And I've got some more detail on that if you're interested in quality improvement for nurses. So I know as students you'll want the references, so you might want to stop the slides to get these references. I hope you found this session helpful. Do ask any questions in the YouTube comments. If you would rather do it as a DM where nobody can see it, you can do that through Twitter or my website or Instagram. And if you're interested in buying any of my books, do look at the links in the description, the YouTube description for the links.